We were blessed enough to be here. When you're dealing with something like the brain or any type of surgery, you really do have to be careful who you choose.
Hi, my name is Kevin Hodges. I've been diagnosed with glioblastoma brain cancer, which comes in stage 4. I am now currently off treatment, but how I discovered I was having these is I was having symptoms. So basically during the time of COVID, we all got sent home. So I was in my home office and I started getting really bad headaches. Like terrible. Yeah. Where I was taking far too much ibuprofen that was probably safe for me at that point.
It started end of March 2020. So that was right in the beginning of the pandemic, COVID-19. A very unusual time for all of us. And he had to start working from home. So we thought, and then probably just a week into working from home, he started having these really bad migraines. And he had migraines before, but never this intense and that lasted more than a day. We thought, okay, maybe it's his home office. He's not used to working at home for that many hours. So we thought, the screen or the position of his keyboard, the chair he was in. So we switched all of that out. Nothing was working. He still was having these migraines, taking ibuprofen. And this was going on for at least 2 weeks. And we were very concerned. I know I was. And I said, we gotta go to the ER or something. And he didn't wanna go because COVID. This went on for 3 months. It got to the point where I was so frustrated I just didn't know what else to do. I was researching any type of way to cure migraines. In the beginning of June 2020, he woke up in excruciating pain.
It was bad. It was like almost nauseating how bad I felt.
Well,
and I couldn't speak properly.
He was mumbling his words. He was crying. He was freaking out. Then he vomited as well. We rushed to the ER. And of course, this was during COVID. I was outside for like about an hour. Now, this was at a different hospital, not at St. John's, but I'm sure it was the same protocol for most hospitals. Then eventually they said, you gotta come inside. He's not able to answer where he works. He can't answer his birthday. Just basic questions. And I knew that wasn't good. And then they did a CT scan. They said there's a mass, this about 3 centimeters? 3 centimeters in his left frontal lobe. And I remember the feeling of like, this isn't real. It just felt like a movie. It didn't feel right. And then from there, they took him to the ICU. They said they had to do an emergency operation because the tumor was pushing on his ability to speak. Within 3 days, he did what was it?
An awake craniotomy.
An awake craniotomy,
yeah. That was an experience.
Very scary, very scary.
Yeah, right?
So he did that. He passed that. He came out fine. He came out talking.
As I do.
That was a miracle.
Yeah.
And so then after his first surgery, we were searching for other oncologists because the original oncologist was just a general oncologist, not a neuro-oncologist. So brain cancer specifically. We were introduced to Dr. Kessery and PNI, the whole group at St. John's Cancer Institute. And we immediately got an appointment at less than a month from his initial surgery, came here, and they always have to do another scan just to see where things are. They said, whoa, you have an infection. It looks like there's a lot of pressure right now, and we need to do another surgery. And so that was
fun.
That was intense. He wasn't showing any sign of infection either, just tired. Love Dr. Barkhoudarian.
Oh, he's the best.
Yeah.
He's the coolest guy.
Yeah. I always joke with him. I go, you're the only one that's allowed to get inside my husband's head besides me.
Yeah, he's so cool.
He's fantastic. And it's such a night and day experience when you finally find a surgeon that knows what they're talking about versus one that isn't as confident, we'll say. And Barkhoudarian had that confidence and the knowledge, because Kevin was scared. Obviously, it was been less than a month since his first surgery. And he said, but with Barkhoudarian, he said, we're gonna put you under and we're gonna do the surgery. He goes, wait, you're gonna put me to sleep? I was awake for the first one. They told me I had to be awake because they had to make sure they didn't ruin any parts of my ability to speak. And Dr. Barkhoudarian says, no, the tumor is nowhere near your speech. You don't have to be awake. You don't have to be awake. So he was a little
I get
scared.
Nervous.
He was scared about that because he likes to talk.
I love talking. I'm good at it.
And so he did that, and he came out with flying colors as well. And they got rid of the infection. Dr. Barkhoudarian said an infection like that would not have ever happened here. It was a real eye-opener when you're dealing with something like the brain or any type of surgery. You really do have to be careful who you choose. We were blessed enough to be here, and anybody that I meet that we talk to online or that are saying, they know someone that has glioblastoma, which you find out is actually not that rare. Once you're diagnosed, you actually find out there is a lot of people suffering with this, and that's why we need to find more treatments. And we always recommend this group.
100%. Because she works in the hospital as well, so she gets a lot of like face-to-face with patients. So she and then she everyone knows at the hospital that I have glioblastoma. So the nurses talking happens, and so people come to her.
Another huge difference between this group and any other group is they not only offer care for the patient, which is their number one priority, but they were offering me care. And I was like, oh, no, it's fine, I'm fine. They're like, no, it's very important that the significant other or, the family are also cared for. And that was another eye-opener. And they make sure that, I've cried in front of them many times and come to them with my concerns, and they've always been very supportive, whether it's through finding a therapist, talking to the social worker. There's a lot of things that go on while your loved one is sick. And when it comes to the bill, bills still gotta get paid. Things have to get done around the house, and things have to keep moving. And they definitely support you in anything that you need. You just bring it up to them. When you're first diagnosed, you usually go right into 30 days of radiation. And while you're doing the radiation, you take temozolomide, which is an oral chemo. And that's the standard of care. Once you pass that standard of care, then you're offered clinical trials.
Correct.
But Kesari's group was different because they actually offered a clinical trial while on the standard of care. And that's why that was another reason we went with Kesari, because when it comes to glioblastoma, what do you gotta do? You gotta throw the whole kitchen sink at it. Everything and the kitchen sink. Yeah. It's just you gotta be prepared, and you gotta be ready.
100%.
You gotta be ready to fight. And this group has that. They have all the tools for that. First couple weeks were okay.
It was good. I was good.
But then by week 3 is when the radiation starts to really
get you.
Made him really tired.
Made me tired. It gave me a really bad sunburn on my face.
Yeah.
Then the chemo was starting to really hit me a little harder, and I remember just losing this patch of hair for a while, which was so cool.
It was looking a little weird. We actually just shaved it all off at that point.
Just shave me. Let me just relax on the couch for a while,
Yeah, but they, any symptoms he had, whether it was nausea, constipation,
it was answers.
Sores, they always had a treatment and something, and they were quick to respond, quick to communicate back, really great follow-up. that helps. So it helps so much.
Yeah.
And knowing that they were on the same page as us. But unfortunately, the tumor came back.
Yep.
What was it, only 5 months later? No.
From what I remember, it was good. I had the standard of care. Then I got onto the first study.
After the radiation,
I went on to the first
went
clinic.
on to the trial.
Correct.
A lot of this, we didn't have to think too much. They were like, this is what you're gonna do, this is what you're gonna do.
It led us into it.
Thank you, we have enough going on. And while he's doing this, he has to have an MRI every
2 months.
It was every 8 weeks.
Yeah, every 8 weeks.
And so the MRIs are to make sure that what we're doing is working, right? Did some other tests, found out it was actually more tumor that came back. You went in for a third
craniotomy.
Yeah. His was 8, was it 8, 9 hours? 6 to 9 hours. You know, he's asleep through the whole surgery. And I'm just waiting. I'm just waiting and praying that he's okay. But luckily, they were checking in on me while he was having his surgery. Very different than the first group we were with. And them checking in on me like every couple hours, it was just such a like, okay, he's doing okay. I loved that they did that. And so yeah, he came out once again, talking and doing great. You know, it's a journey, obviously, and but the doctors are there the whole time. The team is there the whole time. And after that, you were offered the second clinical trial.
The Oblato.
The Oblato, which is the OKN-007, is the name of the chemo drug. It was to be done 3 days a week for 2 hours. And we made that commitment.
Yeah, now we did.
Yeah.
Now we did.
You did,
Those were long weeks.
Yeah.
And then after the first cycle of the drug, you go down to every 2 weeks. So you go in every 2 days, you know?
So yeah, 12 weeks, 3 days a week, 12 weeks, 2 days a week. The MRI was stable for a year while he was doing the trial. So eventually they said, well, now it's up to you, but we feel that it's probably time. We don't know because you've been on this the longest. We don't know the long-term side effects. We also don't know if it's really treating anything at this point either, because everything looks exactly the same. And so we made the decision that it was probably time to get off the trial. He's been off the chemo for 6 months now. Yeah. That was scary at first, though. It was, he was kind of like, I don't know, you know, and they said, that's okay if you want to just come in like every 2 weeks. You know, they would still make adjustments for us, guiding us through this whole thing.
That was it was cool. They were there. They helped. They helped pay for gas because we were driving in so much.
Oh, yeah.
Yeah.
Yeah, there was nice little perks, obviously, when you're going through all this trauma. You just need all the help you can get, really. 100%. I think that was the hardest part in the beginning for us, was we weren't really the type to ask for help. We like to do things on our own. We're very hardworking people, but you quickly learn with glioblastoma, you need the help.
Just a little bit.
Just ask for help. People want to help.
So yeah, the first night you cry it out. Just get it off you. Just like let it go, you know? Like you gotta do something. You're gonna shrink into a hole that you probably won't ever get out of. So then what I did is I was just like, no, I don't have a time limit. That's the thing. Why are you gonna tell me when I'm gonna die? You just gotta survive as long as you can. And the trick is like, don't be sad. You gotta fight, you gotta stay happy. If you're not happy during the fight, then why were you even put here to begin with, you know? That's the thing. You gotta think you're gonna live, you wanna survive. That's the guarantee of life. No one's guaranteed tomorrow.
My advice is, you're not a statistic, right? Like kind of on the lines that Kevin's talking about. You know, they told him he had 18 months. Okay, he's at 48 almost. At first, you're like, okay, this is it. And it's real bleak, you're real scared. If you Google it, it's so scary.
Don't Google it.
What gave me hope was I looked on social media, I looked on Instagram, I looked on Facebook. I found survivors of glioblastoma. And I said, oh, this isn't a death sentence. There is hope in this, and there is support. And you just gotta go looking for it. You just have to stay focused and go looking for the help because it's out there, and ask for help. Don't be afraid. Always love more. Love more. Tell each other you love more. I know this sounds so cliche and like goo goo gaga, but it's true. It's true. You don't really have any other option but to love more and just keep going and fighting. I think what helped us the most was finding the right group.
Yeah.
And our humor, our dark humor about it. And finding other survivors. There's a lot of great people out there that I follow on a daily, I communicate with. We're so lucky we live in a time that we have the technology to talk to anybody in the world at any given moment. And putting your story out there, telling your experience so that others can help others along the way.
Great to see you, Kevin. And I know we've been seeing each other quite often.
Yeah.
For a long time. I think you were diagnosed back in 2020, is that right?
Yeah.
With a glioblastoma. And I know a glioblastoma is a tough journey because it's an aggressive cancer that starts in the brain and affects the brain, and the brain affects the rest of the body as well. And because a glioblastoma is typically an aggressive cancer, we try to treat it aggressively here at St. John's. I know you've been through surgery, and then we tried standard of care therapies as well, things that we know are occasionally effective in this, but not always. And sometimes things progress and the cancer grows. And we were fortunate that we had 2 clinical trials that we were able to get you on. The first clinical trial was pretty soon after the standard therapy wasn't working anymore. And it was an investigational therapy where we were looking at the use of a special molecule that was tied to a nanoparticle so that we could get this into the brain, into your brain, and kill those cancer cells. How did you do with that first clinical trial?
It worked out for a little while, but I had gnarly side effects from it. And a lot of that was just the sores that had developed in my mouth. So luckily for me, because I was getting like kind of abused by that one, the cancer had come back, and that was when it was decided that we're gonna take you off this one, we're gonna go in, and we're gonna do another surgery on you, which is to remove all the growth. And then I got onto the second one, which was the Glioblastoma, which I think did an amazing job of keeping me alive.
Yeah, we did get you onto that second trial with another therapy called Glioblastoma, which is a new mechanism of fighting these types of cancers as well. And you did tremendously well with that. And you're out 4+ years now, which is fantastic. And clinical trials are tough. Sometimes we're investing in a new way of dealing with this, and they can have side effects. You did have some side effects to that first trial. It did work in that it controlled the tumor for a while until the side effects became so much. The second trial, the Glioblastoma trial, worked really well. You had almost no side effects.
I had no side effects. Yeah, that was like the amazing one.
And it kept this cancer from growing for a very long time. And it still has.
Yeah,
and your cancer's still under control. You've been off treatment now for a while. How long have you been off treatment?
I believe about 6 months now.
6 months, great. And how are you feeling?
I feel amazing.
Great.
I'm not gonna lie. I feel really good.
Right.
And I think that's a big part of it, is just, being happy, staying confident, and just knowing that, like, if you get upset and you get depressed about it, it doesn't really help. It's kind of like been shown that doesn't help you. So sometimes you just gotta take it as it comes and just stay positive, and that's kind of how I was thinking about it the whole time. Now there was days where I would I'd wake up super depressed, because it's like, why? But it's less of a why and more of a do. You just got to know that you're going to survive it, and as long as you're getting the proper treatment and support, like my wife had given me,
and the support from the team.
The team, the team was phenomenal.
Something I always remember you saying to us, Dr. Wagle, is don't worry. There's a plan B, plan C, plan D. There's always something else we can do, and that hearing that gives such hope. And that's pretty much what would help us a lot of times.
Yeah, a lot of times it's finding what works for you as an individual. We know that there are therapies that are out there, but you have to find the one that stops your cancer, keeps you healthy, keeps you with your wife and enjoying life as for as long as possible. And a lot of times it's through clinical trials, because as you know, with glioblastoma, there are not a lot of great approved therapies.
Right.
Once you're past that first stage, there really isn't anything that has been shown to be efficacious. And so clinical trials are an important, a vital part of how we're going to deal with this. And sometimes it works tremendously well. And I think you're a prime example of that.
I hope so.
And but it's an important part of moving this field forward, but more importantly, getting people longer lives, healthier lives, and more time with the people and the ones that they love. How did you feel about Kevin going on a clinical trial?
Because it's so limited on the treatments for glioblastoma, so it's only standard of care, which is radiation and Temodor, having option to go on a clinical trial was wonderful. That was hope, actually. Obviously, you don't know the side effects, but you don't really have any option. And having the option helps you. It's you know, when you can see a path ahead of you, it's just something to gravitate towards. So the clinical trial, I'd say, was great. I mean, having that option was what we wanted. And I would be way more scared if they said there's nothing else we can do.
I think hope is an important part of any journey,
right.
But particularly in cancer. As oncologists here at St. John's, we want to be purveyors of hope. We would develop these trials so that we can find that next cure, and that's the goal. Because we want to pick the right trial at the right time. So in your case, we knew the diagnosis, but it's also very important to know what treatments you've had before, what the tumor looks like, where it is, and also some of the molecular or genetic features of it are very important to getting you on the right trial. So you were selected for this trial because we thought that this agent would be particularly effective in trying to control that cancer based on the surgeries that you had, based on the pathology, and based on how you're doing. Those are all very important factors in picking the right trial. So we think that the Oblato trial was the right trial at the right time for you. And I think that comes with knowing how to treat these types of cancers. You have to be able to pick the right agent at the right time. Sometimes it's on the trial and that worked for you. Sometimes it's with other therapies that are on or off label for this. And we wanted to be on that Oblato trial because I thought that this may have the best potential for controlling the tumor. And we had known, because we had had a couple of patients on study, that it was pretty well tolerated. In going through that first trial, which had a few more side effects, we wanted to have something that would give you that quality of life, but also work as well.
I'm always kind of blown away the fact that the second trial was just like the perfect one. It matched. I didn't have any side effects from it. I was getting energy back. And I believe that trial was probably the perfect choice for me. I'll just kind of like brag a little bit. Even the corporation that was sponsoring it wanted like how I was doing, because I didn't have any side effects and stuff like that. Life's getting a little easier. I'm not gonna lie about it. Life is a lot easier. I don't have to stress so much about coming here for treatment every week. And that's like the big one for me.
Of course. We're still watching things.
I know.
Sure. And we're always in the background thinking about what we should do next or how we move forward from here as well.
Yeah.
So we'll always have a clinical trial or an option
I hope
available. Hopefully we won't need it, but it's there.
It's there.
We do.
It's there.
So, Kevin, one of the things with your journey that I think is always stands out to me is that you've really experienced the multidisciplinary aspect of care at PNI and St. John's in a very unique way, because you've had surgery, you've had grafts, you've had, with all your ups and downs, you've had trials, you've had care with all of us in the brain tumor group, but also our other specialists like neurosurgery, facial plastics. What has that experience been like in terms of being able to get all this care at the same place?
Oh, it's actually been super cool. Like, a lot of it comes down to the fact that, like, I come to one location, you give me all the recommendations and what to do, and then I just kind of go between these buildings, which are not really that far apart when you really think about it. So it was actually really nice, because, like, my first surgeon at a different location from here, he didn't do very well. So we were given the opportunity to come down and see you guys the second time. So that was when you noticed that there was an infection happening and you were like, let's get you back into surgery, let's get this done. Then it was like, okay, the standard of care is done, let's get you on this drug for the clinical trial. And then that drug was like not really working out so well. Then I got into the other clinical trial. And then, and that's kind of like the experience with brain cancer. Like you have multiple disciplines all working for your benefit, and it's nice to be able to talk. And then you have the chemo nurses downstairs. They're awesome, So it was, I would say, it was kind of fun, but not super fun.
Yeah. Yeah. So maybe made easier by the fact that everything
because everything's here, and that's a big part, I think, of the overall journey and the experience of dealing with something like I just did. I'm still dealing with it. I should probably be more honest. I always have hope, because don't ever lose hope. Like you gotta just always remain happy, and sometimes that's a little hard, but.
Right.
That's kind of what I do,
Yeah. I mean, and I feel lucky because I've been able to be part of your care as a neuro-oncologist, and then now you and I are sort of having this different conversation because we see each other in my supportive care clinic where we're talking about survivorship and how do you navigate this and hope and the ups and downs of the scans. And so that's also something kind of different that we offer here, which I'm glad we can learn from each other together.
I hope.
Yeah. And Dr. Wagle, you've been a neuro-oncologist for a long time. I won't say how many years to give away your age. What do you think is the value of a multidisciplinary team? Because when I joined here, I was really so glad that we had so many APPs and nurses and everyone really, dedicated to the cause. But for me, this has been my main experience, but I'm curious your thoughts.
Well, I think it's very important for multiple reasons. One is patient care. So another side to multidisciplinary is that a lot of times there isn't a single way forward, right? So you want to pick the best option for an individual person. Sometimes that involves coordinating with the surgeons, coordinating with the radiation doctors, coordinating with the social worker, so you get the right thing at the right time. And a lot of times here, what we're able to do is sit down and talk about that with the clinicians, the people that are involved in your care, so that we're all on the same page. So we all know this is what we want to do, and this is the way that we're going to proceed. So it's not that you're going to see the neurosurgeon and he tells you what he thinks, and it conflicts with what one of the other doctors. We're all working together and trying to get you the right outcome at the right time as well. And then the other aspect of that is that it makes it a little bit easier, just that you don't have to go from one hospital to another cancer center to an infusion center. It's all right here. So you get the surgery, we see you in the hospital, we see you in the clinic, we get you to the infusion chair and get you on the right study to make that easier for you as well. It's not an easy journey. I know that. But sometimes medicine is cumbersome, and we want to make sure that that part is something that we can address and make as easy as possible, because the journey is hard enough. Medicine shouldn't be, the medical field shouldn't be in the way.
Yeah. And there's so many people behind the scenes that you and your wife know are involved in the care. Like, we couldn't do this work without our nurse navigator, without our APPs, who you know really well, Min and Judy and Emmeline and Gabby and Jared, and just such an amazing team that we have been able to put together. But they do all the messages behind the scenes, they do the letters, and so Dr. Wagle and I get to come and see you on the day of, but I know that they've been accessible to you. How's that been?
I think Min and Judy, they've been phenomenal. They've been such good. They're like on your side all the time.
Yeah.
Like they worry about you. It's like nice feeling when they like walk in and then like we're just talking about what we did like last time, and it like brings a boost to the moment.
The team.
It's like this team moment where you're like, yeah, you remember and I remember, and it's like it like really builds you up and it makes you feel like confident you're in the right place. Like that's like the number one thing about it. Yeah.
Absolutely.
No, it's the team itself in and of itself, I think, is one of the better sides of it. Like don't get cancer.
Right.
But like
but if you're going to have it,
but if you end up getting it, I think St. John's is the place you should be.
Oh, that's right.
Yeah, no, like, because we had like a fractured team in the beginning, and I'll be honest, I was like not very happy about it.
Where was that at?
So that was down at Thousand Oaks, like around the hospital that I had my first surgery at. It was like my first craniotomy. And they would just kind of spit you out to these doctors, and then the doctors weren't. It was like a lot of people involved, but they weren't all in one office and one thing. And
even if they wanted to, they couldn't communicate with each other.
Right. So it was just like, and it was like that stressed me out a lot. Like that put so much stress on me, because it's like, I don't know where I'm going, and I have to set all this stuff up myself. And like, luckily my wife was there, because during that time, I'm like, I just had my brain cut into.
Yeah. Navigating the healthcare system is no joke.
It was bad. Like I have so much respect for my wife. I have a lot of respect for you guys as the care team. And I think that like being here under the team and your care is like probably one of the main reasons I'm like still kind of bothered.
We're very glad that you're here.
Yeah. So that's like a big one. That's a big one for me.
So with glioblastoma, it's often a difficult disease to treat, and many patients don't have great outcomes. You're here 4 years from diagnosis, still doing well, still feeling well, right? How has that kind of the initial prognosis and how you've done affected you?
From the initial, it was bad. Now that I'm here today, I'm happy. I'm more confident. I just feel like I'm probably doing the best I could like honestly ask for.
And it hasn't been without its dips and ups, right? So we talk about like the journey of glioblastoma. You just mentioned it's so hard because it's in your brain, but that means it's impacting every part of your life. So there have been periods in this time that you haven't been able to work, that you didn't know if you could go back to work, where you haven't been able to do things for yourself. So it's such a testament to you and your wife's dedication and care. I remember also your family, your dad bringing you to infusions being here every week. It's been such an experience, I imagine, for the whole family to go through that, that I'm sure these moments are so precious. But of course, there's fear associated with that too. And so I think we continue to walk with you on this because for anything that might come in the future. But I just want to acknowledge how challenging this journey has been, but also your perspective and your resilience, which is why in this month, we really like to celebrate the resilience of our patients and their families with Brain Tumor Awareness Month, because the reason we do this work is there's no one like our patients. They show such incredible courage and resilience in the face of such adversity. So thank you for teaching us these lessons.
I'm trying.
God bless you guys. Thank you so much.
Yeah.
Thank you.
Thanks for helping me survive.
Thank you for giving us the chance and listening to us. Yeah.
That's kind of what it is. And I love you.
I love you. I knew you could do this. I told him in the beginning, I said, you're going to get to the point where you get to help others. Sorry. And he goes, yeah.
Yeah.
I mean, come on, let's do that. That's like the ultimate goal, is to help others, right?
Yeah.
So we're glad we can do that. Yeah.
Yeah. It was fun.